Hello viewers, I am Dr. Amit Reddy. I am an orthopedic surgeon at Continental Hospital. I specialize in treating the bone and joint related issues. Today we'll discuss about a very common problem, that is knee pain. So we get a lot of queries asking, why do we get knee pain? Is it preventable? What's the treatment? Is there anything that we can do apart from a surgical solution? So let us start from the beginning. Why do we get knee pain? So knee pain is a very generic term, and the one thing that we'll be focusing today on is the age-related or the damage which happens to the knee joint because of the natural process of aging. That is what we call as degenerative arthritis. Apart from this, knee pain can occur from multitude of other issues such as issues pertaining to the cartilage, or sometimes to a structure here called as the meniscus, or sometimes to the ligaments around that region. Today we'll discuss about this age-related arthritis, that is the degenerative osteoarthritis. So what happens in that? As time progresses and as the process of aging happens, some of the cells in our body break down and they stop regenerating, and eventually there is some amount of damage which occurs to multiple tissues, and within the knee joint we tend to see damage to this particular structure called the cartilage. Now, in simple terms, as long as the cartilage is fine, you never have any issues. But once the cartilage is damaged, that's when you start experiencing such sort of a pain. Now, there are multiple other things which contribute to early damage of this cartilage, apart from aging, such as certain arthritic conditions called rheumatoid arthritis, ankylosing spondylitis, and in certain skin related issues such as psoriasis, where it ends up causing psoriatic arthritis. So these are certain conditions which cause earlier damage of the knee joint as compared to the natural aging and wear and tear that happens. Apart from that, sometimes certain pre-existing injuries such as fractures around the knee joint can make you prone to this arthritis, which again leads to damage of the cartilage, and the end result is pain. So when you say, can we prevent it? Yes, there are certain lifestyle modifications that you can do which can slow down the process or prevent it to a certain extent. One of the known factors is obesity. Irrespective if you are 50 kgs or 100 kgs, your knee joint is the same. And more the weight, higher the chance of damage. And we tend to see people who are obese are more prone to knee joint damage as compared to someone who's within the normal BMI limits. Physical activity again is important. People who are absolutely immobile, or the physical activity is very minimal, in such scenarios also we tend to see that the joint damage occurs earlier. Now, apart from that, there are certain dietary changes that can make you prone to this. For example, raised uric acid levels within the body. They can also cause earlier damage to the joint, leading to something called as a gout, and ultimately the end result is pain. Now, all these issues the end result is the joint damage leading to pain. Let it be the aging factor, or something where a pre-existing condition occurs. So in such scenarios where you have a pre-existing condition, such as the ones which I've just explained, it is ideal to identify it and treat it at an earlier stage to prevent it from damaging the joint and causing long-term morbidity to the joint. Coming to the treatment parts, so a lot of the certain supplements which help in promoting the joint cartilage regeneration, which are known to decrease the inflammation around the joint and promote the joint life, or keep it mobile for a longer period. Apart from that, there are certain mildly invasive therapies such as PRP injections, platelet-rich plasma injections, and certain other therapies called as viscosupplementation, which help in promoting the natural joint life and prevent it from earlier damage. In cases where there is complete damage to the joint, knee replacement is the ideal long-term solution, which we advise elderly people primarily. So in case of any such doubts, feel free to contact us. We'll be available to help you out with such things. Not just treating the joint problem, but in fact preventing it too. Thank you.